Hi, my name is Crystal. I'll be your nurse today. Can I go ahead and verify your name and date of birth? Miss Mary Lou, August. Okay, sounds good. I'm going to go ahead and get an IV started. Your doctor prescribed some IV therapy, so we're going to go ahead and put an IV in you, okay? I'm going to go ahead and do my hand hygiene, and I have all of my supplies. I have my 24 gauge needle. I have my IV insertion kit. I have my normal saline and my IV extension tubing. I chose a 24 gauge because that will accommodate my patient for the prescribed therapy that they have from their doctor. So now that I have everything gathered, I have my sterile filled. I'm going to go ahead and take my extension line and I'm going to go ahead and prime it. So I'm going to prime it to make sure that there's no air bubbles when we get the IV in. And we go ahead and flush. So IV looks good, no air. So I'm going to go ahead and take my tourniquet and I'm going to apply it 4 to 6 inches above my proposed insertion site. So I have my tourniquet on. I'm going to ask my patient, how does that feel? Making sure it's not too tight. It's okay, Miss Mary Lou? Okay, good. So I'm going to go ahead and feel the pulse. I feel it distal to my proposed insertion site. It feels strong, okay? So I'm going to go ahead and take my rubbing alcohol and I'm going to rub it in a circular motion. And I'm going to let that completely dry for 30 seconds. So that is my 30 seconds. I'm going to go ahead and begin to get my needle together. So I have my 24 gauge catheter. I'm going to pull the skin taut. I'm going to use my thumb and my forefingers to make sure I'm stretching the skin. As I'm exerting, I am going to go ahead and insert with the bevel up, and I'm in. I see a flash of blood. So once I have my flashback of blood, I'm okay to advance about quarter of an inch more. So I'm going to go ahead and advance the catheter in to the hub, and I'm withdrawing the needle while I'm still pulling this skin taut. So I'm going to go ahead and advance that catheter so that my I'm still stabilizing though, so my access device is stabilized, pulling the skin taut. So once I have that insertion in, I'm going to go ahead and make sure my catheter hub is against the insertion site, parallel to it. I'm going to hit my retract of my stylus and my needle is going to retract. I'm going to place that immediately into my sharps container, and I'm still stabilizing my site with my non-dominant hand while I'm removing the tourniquet with my dominant hand. And then I'm going to connect my luber lock, and I'm going to make sure not to touch anything to maintain a sterile field, and I'm going to connect that into my catheter hub. Once I have that in, I'm still stabilizing. I'm going to draw back to get a return of blood. I have my return of blood, and then I'm going to flush the catheter with normal saline. So once I have that flushed, I'm going to use my clamp, and I'm going to go ahead and clamp that close, and then I'm going to remove my normal saline, and I'm going to put that in my sharps. I'm looping my extension tubing, and then I am going to take my sterile dressing and I'm going to apply that onto my access site. So once I have that onto my access site, I'm going to secure my tubing with tape right there, and then I'm going to put on my dressing after removing this. I'm going to remove, and then the tab that I still have left over here, I am going to put my name or my initials. I'm going to put the date, I'm going to put the time, and I'm going to put the gauge catheter that was used. All right, Miss Mary Lou, we have your IV in. I'll be back when the doctor prescribes your therapy time. Does everything feel okay? No pain, no complications? Okay, good deal. I'm going to go ahead and clean up my supplies, making sure that I have all appropriate sharps inside of the sharps container. Everything is dated. I am going to put all of my trash and then remove my gloves. And then I would again perform my hand hygiene. And then now I will go to the nursing station where I would document the insertion. I would document how the patient tolerated. I would document the gauge of the catheter that was used, the site, the time. And I'll be back till you see it when it's ready. Hi, Miss Mary Lou. Okay, I'm gonna go ahead and discontinue the IV. You did really good on your therapy. Everything okay? Any questions for me? Okay, so I'm going to go ahead and perform my hand hygiene, and I am going to go ahead and put my gloves on. Then once I have my gloves on, I am going to go ahead and stabilize my device while I go ahead and remove this tape and this dressing while I am still stabilizing. And then I am going to go ahead keeping my device in. I have all of that tape off. So once I have that, I'm going to take a sterile piece of gauze and place that above my insertion site, making sure that I'm holding it nice and tight. And I'm going to withdraw the hub. And while I'm doing that, I'm doing it very slow, very steady, and I'm keeping it parallel with the skin. So I'm going to go ahead and take that out, and I'm going to apply pressure for 30 seconds. While that's applying pressure, I'm going to go ahead and look at the tip to make sure that everything is intact, everything came out, and everything is intact, and it came out perfectly fine. We're going to dispose of that inside of the sharps container. So this has been 30 seconds for pressure. We're going to take another piece of folded gauze, and we are going to put that on top of the insertion site, and we are going to secure that with a piece of tape. So once we have that secure, we are going to go ahead and gather up all of our trash, everything that we have, including our gloves, and we're going to dispose of everything that's needs to be in the sharps is in the sharps, and we're going to go ahead and perform our final hand hygiene. And that's the end of my video. Thank you.